Opes Health, a multi-specialty healthcare facility at Channelside in Tampa, continues to explore new alternatives for their patients. Joining me today is Stephen Gunnan from Replenish IV Solutions to talk about IV hydration therapy.
Hey, good morning.
Good morning.
How you doing?
I'm well. How are you?
I'm doing great, thanks.
You know, so many times we talk about Opes Health and how you can kind of one-stop shop. I had no idea IVs were included.
Yeah, they, we really got together in the recent past because they offer a lot, as you know. I mean, you can go there and get dental work done, see a doctor, and it just kind of made sense for what we do because, we're an alternative type medicine, but we're an all-natural type solution for problems that people deal with every day.
I was going to say, you say it's a great place for you to do what you do. What exactly do you do?
We do all sorts of vitamin, mineral, electrolyte, amino acids IVs. They provide everything from wellness, chronic fatigue, people who have conditions, athletes, mothers that have, had just had kids and can't produce enough breast milk, or mothers that are pregnant. That's one we just had. I just got a note from a client. She just had her little baby boy the other day, and we were seeing them because she had morning sickness all throughout her pregnancy.
Okay, well, maybe I'm having you on the show a little too late because I just had my baby.
That's
but
what I understand.
You brought up athletes. I remember as a sportscaster, so many of the athletes would get IV treatments in intermissions or at halftime. Now the average person can do that and see the benefits.
Yes. And the thing is that when you're actually getting a better IV now, because when they get the IVs at halftime, they're getting like straight saline or some base solution. So when we give ours are loaded with like B vitamins, C vitamins, magnesium, calcium, and we can tailor it to the individual's needs. When you have just that base solution, it's kind of the one-stop fits all, and it doesn't always work for everybody. It helps, but doesn't give you the benefits that we can tailor to your needs.
I would say, let's talk about tailoring to people's needs. I'm assuming every person is different, and how are you able to explore that to make sure they're getting the right solution?
Well, the great thing is now when they come into Opes, they can go and get a blood work done, and it kind of offers a little roadmap to what they might be lacking on. Or if they just feel like they're run down, you give the people that they're the type A personalities. They live hard, they play hard, and that might be sporting events too. They need to get just a boost, and people don't realize that 60% of Americans at some point during their day are dehydrated. And that causes fatigue, and everybody, what do? We reach for an energy drink, we drink for coffee, reach for something sweet, and that's not really the best answer for anything, because the downside is you're going to feel even more fatigued or more worn out after you're done with that.
Well, I'm curious, hearing you talk and hear about like the vitamins specifically, what's the difference? Why can't I just go to the drugstore and pick up all these vitamins? I mean, the thought of an IV to some people, they're not going to want to do that.
Yeah, I know. This is something, when we started looking into this, my wife and I were talking about this, not everybody's going to want an IV. It's not like the IVs of the past. It's very, very, very simple, very quick. The needles are much smaller. It's not like an emergency setting where you have to do something. This is more because it's an alternative. People want to come in and do this to feel better. And the stuff you get at the drugstore, it's taken in orally. Anything you take in orally, there's so many factors that are involved in that. If it's the absorption rate of if you have some GI problems, if the vitamins and minerals that you're getting aren't good, there's a quality issue with the best to the least quality vitamins. And anytime you have to put it in your mouth and swallow it, you've got to have it broken down by your stomach and before it even gets to your intestines, and that's where your vitamins are absorbed. So if there's any sort of health issues anywhere in between there, then you're not going to get the full absorption.
Yeah, I'm curious, Steve. Normally when folks from Opes Health come onto our show, they always hook up our Morning Blend viewers. What's the hookup today? Do you have anything for us?
Absolutely, of course we do. Anybody that comes in and mentions the Morning Blend, we offer 25% off any of our services. Whether it's an IV, and we do the B12 injections, we do the Super B shots, we do some of the weight loss injections, all natural too. We only use the all natural vitamins that are prepared. We don't use anything that's synthetic or anything like that.
Well, all you got to do is mention the Morning Blend. There's the website phone number. Again, this is Opes Health Channelside. Thank you so much for coming and talking about this.
Thanks for having us in. Appreciate it.
We do too.